and I'm going to be your nurse for today. I'm just going to start by performing some hand hygiene and applying my gloves. I'm going to close the curtain to provide privacy. Can you tell me what your name is and your date of birth?
Keita Mitchell, December 24th, 1996.
Okay, and I'm just checking your armband to verify. The doctor has ordered for me to do a couple of assessments on you. Will that be okay with you? Okay, so I'm just going to start by doing what's called a respiratory assessment, which is where I'm going to check all of your lung sounds, and then I'm going to educate you on the technique we do here at the hospital. Okay. All right. Every time I touch you with my stethoscope, I'm going to ask you to just take a deep breath. Okay, this is the upper right. You can take a deep breath. Upper left lobe. Lower left lobe. Lower right. That's not the lower right. That's the middle right. Excuse me. Lower right. Deep breath. And that was the lower left. I'm going to ask you to sit up so I can get your posterior side. Deep breath, please. Upper left. Upper right. Lower right. And lower left. Okay, you can sit up. Alrighty, so I'm just going to educate you on this technique that we do here in the hospital, which is called the turn, cough, and deep breath technique. I'm just going to ask for you to just turn to either your left or to your right, and just to cough into your elbow. All that is just us trying to open your lungs up and to just get you to breathe a little bit better. So if you will, just turn to your right and just take a deep breath. So deep coughing. Alright. So this right here is what's called an incentive spirometer. So if you will, just hold on to that and I'll show you what to do. If you will, just breathe into it and it'll help you, like I said, just open your lungs up and it helps you reach a certain goal. All right, perfect. So I'm gonna ask you to do that 10 times every hour if possible. Try not to do it back to back, because if you do, it'll probably get you short-winded and we don't want that. All right, so have you been having any shortness of breath at all?
No.
Okay. All right, so now I'm going to do what's called a cardiac assessment on you. I'm just going to start by listening to your heart sounds. And with this, you do not have to take a deep breath every time I touch you. Aortic valve. Pulmonic valve clear. Iris point clear. Tricuspid clear. And if you will you just lift up your left breast, please? Just for a second. Okay, mitral valve clear. Alrighty, so I'm just gonna assess all of your pulses that you have. I'm gonna start by checking your radial pulses, which are right there in the middle of your wrist. Check this to be true. Alright, can I check your brachial pulse? I'm just going to do what's called a capillary refill on your fingers, which means that all of your fingers should refill within about 3 seconds. That's just to make sure that you're receiving proper blood flow to your fingertips, which they are. And I'm just going to push on your arm up to your shoulder. Just let me know if you have any discomfort or pain. this is what's called your capillary, your carotid pulse. Check on both sides. And I'm just gonna check your neck for any JVD, which is in your jugular veins in your neck, and I'm just gonna lower you back just a minute. If you will, just look over to your left side. Okay, I'm not seeing anything. You can look on that side. Okay. Alrighty, so now I'm just gonna check your rest of your pulses. Just gonna ask you to lift up your arm. This one is called your auxiliary pulse. Sorry. Same with this one. This one's called your femoral. And back here behind your knee, you have a pulse called your popliteal. Moving on down, this one is called your posterior tibial. And this one's called your dorsal pedis, right there on top of your foot. And do the capillary refills down here on your feet, on your toes. Just making sure that you're receiving proper blood flow to your toes. And I'm also going to squeeze on your arm all the way up here. Just let me know if you're feeling discomfort or pain. Just checking for any edema you might have. I'm so sorry. Okay. Alrighty. Have you been having any chest pain lately?
No.
Alright. So now I'm just going to do what's called a gastrointestinal assessment. I'm just going to ask you to lay down on the sofa, please. And I'm just, can you put your arms by your side? And I'm just going to palpate all of your different quadrants. Move, starting from your lower right all the way to your lower left. Let me know if you're feeling discomfort or pain. I'm gonna add a little bit more pressure. Okay. Now I'm just going to listen. That was your lower right. I'm in the upper right quadrant. Upper left quadrant. And the lower left. Okay. Can you tell me when was your last bowel movement?
Yesterday.
Okay, and have you been having any flatulence lately, like farting or pooping?
Yes.
Farting? Okay, you have. Would you mind describing what your bowel movement looked like? Was it like loose stool, or was it formed? Was it like little pebbles, or?
It was very loose.
Very loose. Okay, you can stand on up. I'm gonna ask you to stand about right here. And I'm just going to start on the next assessment, which is called your, it's called a Romber's assessment. So I'm just going to ask for you to walk from where you are all the way down here and back. Just walk normally, please. Okay, and if you will, walk back over here, but this time I would like for you to walk heel to toe. Alright, and I'm also also going to ask for you to please close your eyes, have your arms by your side and your feet together, and I'm just going to assess you for about 10 seconds. Okay, you can open your eyes and you just have your seat back. All I noted was very minimal swaying, which is normal. And I meant to ask you while you were laying down, have you been having any abdominal pain? No? Okay. Alright, so now I'm just going to be choosing two upper extremities and then two lower extremities. I'm just going to assess them. Have you been having any pains in your joints?
No.
Okay. So I'm just going to assess your wrist, your elbow, your knee, and your ankle. So when I ask you to, I'm going to ask for you to flex your wrist and then to extend it. If you will flex, extend it. This time I add a little bit of pressure, flex it in, and then extend it. Flex, and then extend it. Flex it in, and then extend it. Did you have any difficulties on either side?
Mm-hmm.
Okay. Now on your elbow, I'm going to ask for you to flex and then to extend. Okay, you can flex it in, extend it. Now I'm going to add a little bit of pressure, flex it in, and then extend. Right. Same thing with that, flex it in please, and then extend. Flex it in, and now extend it. Alright, now for your ankle, not your ankle, but your knee. If you will, extend it, and then flex, extend it, and flex. Extend it, please. Now flex, extend it, and flex. Any difficulty on your knees?
Mm-hmm.
Moving on down to your ankles. Okay, you can flex it and then extend, flex it in, and extend. You can flex, extend it, flex, and extend. Alright, perfect. Perfect. Okay, so now I'm going to be doing what's called an assessment, I'll be assessing your HEENT, which is your head, your eyes, your ears, your nose, your mouth, throat, and your neck. I'm going to start with your head, and all I'm noting is that it's just a regular abnormal shape, normal shape, excuse me. And I was just going to ask you, have you been having any headaches?
Mm-hmm.
Alright, so moving on to your eyes. Do you wear contacts or glasses?
Glasses.
Okay. Right now, I'm just going to, you can just look forward. I'm just going to say your pupils right now about a 3. I'm saying 3. Okay. Now I'm going to look at them together. Alright, and I rate it now as maybe a 6 whenever light is shined upon it. Just checking to make sure that your eyes are aligned with your ears. Moving on to your ears. Have you noticed any excessive buildup?
Mm-hmm.
Do you wear hearing aids?
Mm-hmm.
Have you been having any trouble hearing at all?
No.
Okay. Now to your throat, have you been having any trouble breathing?
No.
So now to assess that, I'm just going to ask for you to close one nostril and take a deep breath and breathe out. Same thing on the other side. Did you have any trouble breathing on either side? Okay. Moving down to your mouth. Just gonna ask for you to open up your mouth just so I can examine. Okay. So I noticed that your oral mucosa was very moist and it was very pink, which as it should be. All your teeth were intact, and I didn't notice any dental decay at all. Alright, so I'm gonna ask you to hold this, and I'm just gonna. Have you been having any trouble swallowing?
Mm-hmm.
Okay, so I'm just gonna have my fingers right there on your trachea, and on 3, I'm just gonna ask for you to swallow. Okay, 1, 2, 3. Okay. Did you have any trouble with that?
Mm-hmm.
Alright, moving on down to your neck. I've already checked for any JVD and I didn't notice any. Alright. And this very last one is called your neurological assessment. Do you know where you are at the moment?
Mm-hmm.
Where are you?
In the living room.
In the living room. Okay. Do you know why you're here?
You need a patient.
Mm-hmm.
And a doctor.
Yeah, and do you know who the president is?
Joseph Biden.
All right. So this assessment I have pretty much been doing the entire time I've been assessing you all together. This is just for us to check how impaired or how unimpaired you are. And it's based off like 3 main things, which are like your eye opening, your motor, and your verbal responses to my questions. So I would like to say that you are very much so impaired. Okay, do you have any questions for me? All right.